March, when we announced the first death at the end of March. Minnesotans now, we've lost 1,837 of our neighbors. We're up to about 80,000 confirmed infections. Life was turned upside down. The things that we watched happen, graduation ceremonies became remote and in the backyard. Weddings were postponed. Visitations to our elderly relatives and friends became much more difficult. And since the beginning of this, we've asked Minnesotans to help us make a difference, to attack this head on, to follow the science, to do it and do what's right for our neighbors. And we have done that. Early in this pandemic, we asked Minnesotans to stay home, to shelter in place so that we could buy a little bit of time to ensure that we had the hospital capacity and the protective equipment, the ventilators, things like that that we needed. So we didn't end up in a situation where we watched coming out of Italy or in New York City. We then moved and we started to see things that we could do, understanding that we weren't going to be able to shelter in place forever and that we had to start figuring out how do we return to some place where folks can go back to work and we can still keep people safe. And we started using the best science to adjust capacities in places like restaurants and bars. And then we asked here just a short time ago, something that we have found over those 6 months that can make a big impact is wearing masks, especially in crowded places and if you're going to be there for an extended period of time. All of those things were meant to slow the spread of the infection, to have us learn more about treatments and therapeutics, and to work us towards a place where vaccines would come online. I said back in March when we had a very unusual State of the State address from the basement of the governor's residence that we were in for a long, dark winter. And we knew it was going to be, and it's turned out to be so. There's many bright spots of folks coming together. There's been great progress made in keeping people who end up in ICU alive, or more importantly, keeping them out of ICU, but we are not out of the woods. And I think for many of us, as we transition to fall, this was a time that I have to be candid with all of you. 6 months ago, it was my hope that we would be back to doing all of those things we talked about, going to the state fair, watching high school football, gathering to watch the Gophers on Saturday, all of those things. Well, the virus has not allowed us to do that, and we have to remain vigilant. We have got to stick with this. As you've seen, it burned hot. This virus burned hot in the Northeast. It moved to the South. It's people seeding things around the country, and now we've seen a lot of people go to different places this summer and bring back infections to the Midwest. Dr. Fauci yesterday cautioned 7 states in the upper Midwest are on high alert. We've seen cases increase in surrounding states, upwards of 200% in the case of South Dakota. With that being said, we have stayed at a relatively manageable, approximately 5.3, 5.4% positivity rate. That number was under 5 up until the last several weeks. It has been creeping up in the recent weeks. What we know is once you get above that number and community spread starts to go, there's a very fine line of a tipping point. Last week, we were visited by President Trump's advisor, top advisor, Deborah Birx. Dr. Birx came and wanted to make sure that we were talking to one another, and what we were seeing, she was seeing. And what she was seeing is the potential for Minnesota to tip over to that place. And pretty terrifying to hear the president's science advisor on this caution us that these were many of the same flashing lights we're seeing look like Arizona before Arizona went where they are. And she was bringing suggestions from the CDC, suggestions from the task force on what Minnesota could do, things that we have been implementing along the way. And so with school opening next week in many communities, we put together that plan at the end of July and worked on it for months, with a very clear understanding. And the day I announced it, I said I felt that it was altogether possible that most students would move through all 3 phases, from distant learning to hybrid to in-person. And I think that's probably the way this is looking at. You're going to hear some more of the specifics from Commissioner Malcolm, but I would tell Minnesotans, we have never shied away from what the facts are around COVID. We have a reputation, and we ended up being the best in the country for our data and the things that we put out. I want to thank this team, Chris Erzman and her folks, the epidemiologists, of being able to continue to craft and evolve as this virus moves to understanding what it's doing, and then to make some predictions that are very difficult to do of what comes next and what we can do to make sure that what comes next is good for Minnesotans, and that is a difficult task. We're going to be joined by Dr. Pham today to talk a little bit on the pediatric side of this, of what's happening, and to try and make a renewed, I guess for me, an appeal to Minnesotans. The most effective things we can do aren't necessarily in shelter at home or things that are very difficult to maintain. They're social distancing, they're hand washing, and they're masking. And Dr. Birx and again, Commissioner Malcolm will get in more detail on this, really trying to understand that especially the Twin Cities areas has been somewhat of a conundrum for the experts as they've looked at this. It looked early on that the Twin Cities was going to go much the way other large cities went, Detroit and others, but we never did. We never spiked out the top, but we also never dropped back down. And so one of the things that I think, and the commissioner can get into the details on this, but in the meeting I had with Dr. Birx, she's just concerned that those very simple, and they seem so innocent, the backyard meetings, the barbecues, families mixing together, not in their immediate family, is driving a lot of what's happening here. And it again, I understand the pain of this. This is the basic social things that make summer so fun. Talking over the fence or sitting around that fire pit making s'mores. But that's exactly the type of thing that we're seeing is having an impact on some of the spread. So we want to make sure that as we go into Labor Day, we want to reset where we're at. We did a lot of these early on as we were learning about COVID. It's my intention for us to continue to put out information. I'm not naive. I know the 6 months have really challenged us as a nation. We have not responded well in comparison to other nations, and we're not done with this thing yet. But there are some proven things that we can do that can make a difference. We have not tipped over that. We are running at a rate lower than about any state in the upper Midwest, and it's our intention to try and keep it there. But again, it's not going to be any mandate. It's not going to be anything we necessarily say. It's going to be behavior changes by Minnesotans that get a crimp on this. And so with that, I would just like to, and Jan's going to come up and run through a bit of a PowerPoint on this, just some of the things that we've already done in the responses to it, from the testing program, and I want to give a big thank you to the Mayo Clinic, to the University of Minnesota, two great organizations. We're continuing to evolve on how we view testing. Our saliva lab will be up and running before too long. We want to just make sure that it's easily accessible. We're down in Mankato today doing free community testing to make sure we know. And I know this is even something like testing, tracing, and isolation has been somewhat controversial. Let's just be very clear. Testing is a key to getting out of this. Testing and the robust testing capacity is one of the keys. Minnesota is not turning our backs on that. In fact, we're increasing our capacity to be able to do that. CARES Act money of making sure those most vulnerable are protected. We've done a lot with that. The mask mandate, again, I just would encourage Minnesotans. We really do have this sense of that we care about our neighbors. That's really what the mask thing is about. Just do it. Do it for the right reasons, and we get through this thing. And if you never want to wear one again, that's my hope, that maybe that's exactly what you don't have to do, because we'll get through this thing, move to the other side of it. And then, of course, some of the other funding that we've worked in partnership with the legislature. So with that, I'd like to let Commissioner Malcolm come up and kind of update you of where we're at. And I preface this with, we're at a tipping point, a potential tipping point, but we still possess the capacity to push back in the right direction. And I really do believe this Labor Day weekend could really have a big impact on that. So I appreciate folks taking the time, and Jan will update us.
Thank you, Governor. Good afternoon, Minnesota. It's good to be back with you visually again today. I appreciate the governor's setup for this. I think you did a great job, Governor, as always, reinforcing the importance of what we're going through together as Minnesotans. I do want to give you just a brief current update on our situation. We, as the governor said, are just approaching 80,000 total cumulative laboratory confirmed cases in Minnesota. Today's exact number is 78,123. That's up 1,047 cases from the report yesterday, on a testing volume of just under 14,000 tests processed. I do want to note that of this 1,047 total, 264 of those positive cases that we're reporting today were actually part of that very large backlog of tests that we received from laboratories a couple of days ago and reported yesterday. So just for apples to apples comparisons, without the positives in today's, without those positives in the backlog, today's new test total would have been 783. But still, that's a significant increase. As the governor said, we have been kind of walking along the edge of a high plateau or a high mesa for quite some time, since really, frankly, early July when we started seeing cases rise again. There are 272 patients currently in the hospital, a net decrease of 25 from the prior day. 138 of those are in intensive care, a net increase of 3. I'm also very sorry to report the deaths of 7 more Minnesotans, meaning that a total of 1,837, as the governor said, of our family members, our friends, our colleagues, our neighbors have died from COVID-19 disease. The governor mentioned the visit that we had last weekend from Dr. Deborah Birx. She is the coordinator and the senior advisor to the White House COVID Advisory Group, which is chaired, as you know, by Vice President Pence. And as we've been saying several times this week, she made some very strong statements to us about her specific concerns for Minnesota, as the governor has said, given that we've been at this high level of cases for some time now. And a high percentage of those cases are coming from what is known as community transmission of unknown origin, meaning that people are out in the community, they're doing multiple things, they don't have a clear idea that they got it from any one given person. But they were in a place where there were known cases positive. And Dr. Birx's point was, as the governor has already said, we are starting to look a lot like other states have looked before they reached that tipping point. And she has seen what's happened in some of those states where vigilance was not practiced. And she really wanted us to be aware that we are in a very similar looking place to what some of those other states were. I just want to show you, this is, should be projecting for you the epidemiologic curve of this epidemic in Minnesota over time. And you can see it really clearly visually. And we post this on the health department's website every day. We update it daily and weekly. And you can just see really clearly what happened with the rapid increase in cases back in the late winter, early spring. Then an encouraging downturn in the cases in the first 3 quarters of June or so. But that respite didn't last as long as we had hoped. And frankly, that's a concern for us that we didn't see that sustained decline during the warm weather months when we might have expected that decline to hold. But instead, we started to see cases go back up. And you can see now we're approaching the same level of cases we were at in the late winter, early spring months. Now, it needs to be said that we're testing a whole lot more people than we were back then, but the nature of the transmission is very different. Back in those early spring weeks, we knew that a lot of the cases were coming from specific settings, specific outbreaks in long-term care, in food processing plants, that certainly did spill into the community, but the origin of some of those cases was really kind of more able to be pinned down to specific sites. Not so with this latest wave, that this is happening with a variety of outbreaks all over the state of all different types. And as the governor's already mentioned, and my colleague Chris Erzman will say a little more about this, a lot of these cases are coming from just a variety of social gatherings, informal gatherings, as well as public gatherings. And that was something else that Dr. Birx really was noting, that this does seem to be a lot of sort of private social activity that is fueling our numbers here. So Dr. Birx was saying, I'm really concerned that you could be reaching that tipping point, and we know with the coming of fall, with the coming of schools opening, both K-12, higher education, colder weather that's going to drive people inside, we're entering that season in a much higher place than we had hoped to be. And as the governor said, we're grateful for the fact, and proud of the fact, actually, that we've kept this pandemic under pretty good control. Even though we've seen rates of increase in our cases, we've not yet reached that tipping point. And that's our fervent hope, is that by kind of redoubling our commitment to doing the things we know work, we can avoid reaching that tipping point. I will just show you next. These are 3 pictures. The one on the left is Iowa. The middle one is Texas. The one on the far right is Minnesota. And you can see there that tipping point phenomenon that Dr. Birx mentioned. And we see this very similar pattern in Iowa, North and South Dakota. Wisconsin's a little more like us, starting to edge up a little bit now. Texas, we all saw the dramatic pictures from Texas and Arizona, Georgia, Florida, where they were also, as you note, in a pretty stable looking pattern until they started to accelerate and then hit what is known in epidemiologic circles as logarithmic spread, where it just begins to just build and build exponentially on each other. And that's what we're trying to avoid. But just because we've been stable for a while, to Dr. Birx's point, doesn't mean we couldn't tip over like some of those other states are doing. So again, we're celebrate the fact that we have fewer people in the hospital, our mortality rates have improved, the improvements we've seen in long-term care are notable, and Dr. Birx made a real point of that, saying, you have really done some amazing work in protecting residents and staff in very challenging environments, and she called that out as a notable improvement in our data that she's been watching very closely and was complimentary of that. I'd also like to just mention a little bit the holiday weekend, as the governor said. We're heading into Labor Day at this high level here. And we know that holiday times with lots of gatherings can further fuel the epidemic. We did see that, frankly, after the 4th of July, when there were celebrations, large gatherings, and we saw an uptick in cases that followed that. But back in July, our average daily case growth over a week period was 482. Now it is 732. The percent of our tests that were positive was 4.3% heading into July 4th. It is now 5.5% according to some of our latest data of what's coming in the lag period. So that's a different number than you see on our website, but our best guess, most recent data is 5.5% positive. Percent of community spread, so percent of the cases that are coming from sort of unknown origin because of the widespread nature of the virus in our communities, was 27.8% back on July 1st. It is 33.5% now. So my point here being, we're in a more precarious situation today than we were heading into the last major holiday weekend, and we just want Minnesotans to be aware that there is risk in this situation. The virus is all over the state. The outbreaks are happening all over the state, and we just want people to be vigilant. And again, it's notable that, and I think Chris may mention more about this too, that it appears from our recent data and from the reports that we're getting of outbreaks at weddings and parties and unfortunately funerals and other types of social gatherings and important milestones in people's lives. These kinds of gatherings are proving to be as much or actually more of a challenge than some of the gatherings that we do in more public spaces. The places we most commonly frequent, grocery stores, retail establishments, gas stations, those are not the places. I mean, in those settings, people are generally pretty compliant with mask wearing and social distancing. But somehow in the more private gatherings, we seem to, too many of us, be of the mind that, well, if it's just our family we're gathering with or just our friends, there's somehow less risk in that situation. And we just need Minnesotans to know that's just not the case. Even if we're outdoors, if we're close together for long periods of time without masking, we see transmission happening. So it's so key to maintain those 3 pillars that Dr. Birx talked about. Important to avoid large, close crowds. Important to maintain social distancing, and important to wear a mask, particularly when you can't maintain that social distance. And we need all 3 of those things to happen. They're like layers of protection. It's not one alone that's the magic protection. It's the layering of those things. And again, Dr. Birx reinforced the very messages that you've been hearing from the governor, lieutenant governor, Chris and myself and others for so long now. But it's so important because it just seems as though it's not quite getting through, that those pieces of advice and guidances are as important in private settings as they are in public. They're as important outdoors as they are indoors. So this Labor Day is setting up to really be a critical time for us to not follow the pattern that we see in Iowa and Texas. And as the governor's already said, in March, when we first talked about and tried to explain the need for these strong community mitigations, it was about buying time to learn more about the virus, to prepare our healthcare system to be able to deal with more cases of severe illness as the virus spread. Now we know more about the virus. Now we know it's not only hospitalizations and mortality that we need to be concerned about. It's very long-term health consequences and severe health consequences that come from courses of this disease that don't even end in hospitalization. We know now about asymptomatic spread, how easy it can be for somebody that doesn't even know they're infected to unwittingly infect loved ones, or to bring the virus into settings like long-term care, schools, hospitals, workplaces. So this isn't just about avoiding individual illness at all. It's about protecting our loved ones, our communities, and frankly, our economy. So we are very much grateful for everything that Minnesotans have done and sacrificed to help us manage the pandemic as well as we have to this point. But we just need you to know how critical it is that we keep that up, and more than keep it up, that we really redouble our efforts all across the state. And with that, I would like to turn it over to my colleague, with great gratitude for her work and her colleagues, Chris Erzman.
Thank you, Commissioner. Again, I'm Chris Erzman. I'm the Director for Infectious Disease at the Department of Health. As Commissioner Malcolm said, we are seeing a concerning number of outbreaks associated with social gatherings like weddings, funerals, and private parties. Our proportion of cases identifying unknown community transmission is over 30%. And I'd like to tell you a little bit more, tell you some stories about these outbreak situations that we're seeing. But let me first say that when we talk about the number of cases that are associated with outbreaks, that we only know about the cases when individuals are tested. And we only know about outbreaks when people tell us about their activities. So the information that we share is not a complete picture of what's happening in Minnesota or a particular county. Additionally, we know that each case results in more cases, and we do not count what we refer to as secondary cases as part of outbreak totals. So we only are counting the directly linked cases, that is, the person that actually attended the event. So the data we have provide us with a picture of what's happening in the state, but significantly underestimates the true impact of COVID on those gatherings. To illustrate this point, I'd like to describe a couple of outbreaks that we've recently seen. One outbreak involved a wedding reception in southwestern Minnesota, which exceeded the executive order guidelines for capacity as well as social distancing, with 275 guests in attendance. And guests did not wear masks. We now have 56 cases associated with this wedding, and there are 9 counties involved. Some of these cases are educators, long-term care workers, and healthcare workers. We know that there are even more cases associated with this event, as we're hearing that people are not being tested to avoid driving numbers up. Of course, by failing to acknowledge a problem, you don't make that problem go away, you just make it worse. People who don't get tested for COVID because they're fearful of the impact for themselves or their school or their community, in reality are making the problem worse, allowing the virus to spread undetected in their community, which prolongs the outbreak and rolls the dice with lives of people around them. Another example of community transmission causing problems involves the Sturgis event. There's been a lot of interest in the number of cases who indicated that they had been to Sturgis. We're currently at 50 cases associated with this rally, including, unfortunately, 1 death. However, we have also followed up on a cluster of cases associated with a wedding attended by a person who had recently returned from Sturgis. The decision to attend a high-risk event and then not self-quarantine upon return resulted in others getting sick. The common thread running through these examples is that during a pandemic, one person's actions and decisions don't just affect themselves. They affect those around them, at work, at home, and everywhere else they go. We need people to understand that their risk tolerance or confidence in their own ability to shrug off COVID doesn't mean they can't pass it along to others who can get seriously ill or even die. The bottom line is that none of us are an island. 6 degrees of separation is the idea that all people are 6 or fewer social connections away from each other. At MDH, we see those connections in the movement of COVID across the state. Please do your part to break these chains of transmission. Thank you. And with that, I'd like to turn it over to Dr. Pham.
Hello, thank you for inviting me, Governor, and the rest of the team here. My name is Dr. Ku Pham. I'm a physician at M Health Fairview. I'm assistant professor at the University of Minnesota Medical School. I work both at the University Hospital and at Community University Healthcare Center, also known as CUC in Minneapolis. I'm also a board member of the Minnesota Doctors for Health Equity. I'm both in internal medicine and a pediatric doctor, so I get to see people of all ages, which is a privilege of mine. Those of different colors, backgrounds. They're from all over Minnesota. Some of them are from Red Lake, from Cannon Falls. Some are unsheltered, some work in grocery stores, some are small business owners. But most of my visits today are through video or through phone calls. Occasionally they're in person. Of course, when I'm doing that, I'm wearing a mask. So like everyone else, I miss seeing people's faces, their smiles, and getting hugs in clinic. But the sad facts are, as everyone mentioned, COVID continues to spread in our communities, no matter who you are. That Black community, the Indigenous community, the communities of color are suffering and dying at higher rates because of their access to care and test. Our elders are stuck in isolation. Our children are still getting sick from multi-system inflammatory syndrome. I have friends, parents who have died from COVID. I've had my own patients who have clots and been on breathing machines and still suffer from those consequences today. We still have no cure and no vaccine. But the positive facts are, I still get to smile under my mask when I see others are wearing their masks in public. To me, that's really an ultimate thank you and a hug to all people who are working in restaurants, in grocery stores, and in healthcare systems. It is fortunate that our hospitals and our clinics have been able to stay under max capacity during this period of time and save lives for all the measures we've done recently. At the same time, the Minnesota healthcare systems have worked hard to change and be innovative to contain COVID-19. For these reasons, I'm really proud to be a Minnesotan. But I think as we approach the fall and the winter, as our kids return to school, our future generation goes back to college, I am concerned that we're going to hit a new peak, and that because of our desire to be normal again. So I would ask you to please listen to your community leaders, talk to your healthcare providers, go to the MDH website, and kind of stay away from all the myths that you're seeing on social media. Stick to the truth instead. Continue to social distance, avoid large crowds, wear a mask at all times, ones that are covering your nose, your mouth. They're really cool designs that you can see in your local stores these days. I have several masks on me right now in my pocket. Get tested when you need to. It's free. I mean, some of the testing nowadays, you can self-swab. You can actually swab in your throat. It doesn't have to tip your brain through your nose. Get a vaccine. Get your flu shot. We know that works. And outside is better than inside. Go camping, go biking. That's what I'm going to do toward this Labor Day weekend. So let's keep showing the nation as Minnesotans that we can still have fun and be safe. Thank you for your time and your commitment to keep Minnesota safe. And we got Lieutenant Governor Langen.
Thank you, Dr. Pham. I too have an extensive mask collection, and that's one bright side, right, of all of this here. So Labor Day weekend is upon us, and it's the unofficial goodbye to Minnesota summer as we transition into the chillier, often busier days of fall. And any other year, as the governor said, you would see me at the Minnesota State Fair every single day. But this isn't just any year. Overall, as we've heard, Minnesotans have done a pretty good job of masking up, staying 6 feet apart, and staying home when they're sick. But 6 months in, here we are, we have to continue doing these things, even and especially when we are around our friends and family. And as we have seen, we have started to see troubling signs of increased infections across the state. And as was mentioned, we are seeing many of those cases tied to private gatherings. I know it is incredibly difficult not to hug your parent or your grandparent because you don't live in the same household. And it can be awkward to ask your friends to wear masks when you're spending time together. And it's a hassle to keep sanitizing your hands if you're at a neighbor's barbecue. But just because you're over the pandemic, it doesn't mean it's over you. And as it grows colder and we approach flu season, it is critically important that we take all the precautions we can now to prevent the spread of COVID-19. That includes, again, mask wearing, social distancing, washing your hands, and please, please, please get your flu shot. And I know all of this is so hard. And as the governor mentioned, we had those dreams of going to the fair, of going to sporting events in the fall, of all of our students being able to attend school, not wearing masks and in classrooms together. But because of this pandemic, it is still very much upon us. We have to take it seriously. And so Minnesotans, don't stop now. We have to keep it up. And with that, I will turn it back to the governor.
Thank you again. I know this feels a bit like deja vu. It's like we're back in April again, but the numbers indicate we are back to that point. And as Lieutenant Governor said, the virus doesn't really care that we're tired of it. The virus doesn't really care that social media tells us not to worry about it. It's just the flu. Those things are not true. And we have to base it on science. We have to be smart. We have to make sure we do the things that keep our businesses open, that do get our children back in school, and that move us towards that point when we can start to think about vaccines coming online. When that happens, I think the news sounds encouraging, but encouraging and hopeful is not the same as what's happening right now. So we are asking Minnesotans, give a little extra thought to it. Dr. Pham is right. You can still do these outdoor things. Just be careful when you're around others. Wear the mask. Let's try and get a handle on this. And I've said it from from March going forward. There will be a day when we're on the other side of this, but our responsibility right now is to protect our neighbors, to make sure that we prevent avoidable deaths, and that we understand what Commissioner Malcolm has been saying for quite some time. One of the things we don't know about this virus is the long-term damage it's causing, because we haven't seen yet what it's going to look like for someone who is infected months and months down the road. And I don't know, it sometimes takes celebrities to get this, to tell people that it's real, with Dwayne Johnson getting it when The Rock says he and his family got sick and they didn't think it would happen and it was a bad, bad thing. Maybe that's what it takes for people to hear this. So we got work to do, Minnesota. We'll be glad to take any questions. Tom?
A cold, dark winter ahead, and that's come to be so. But some of the numbers say differently. The number of deaths are down dramatically. Hospitalizations have stabilized. The positivity rate has gone up a little bit. But some people think you're being unduly alarmist and standing in the way of opening up more of the economy. How do you respond to that?
Well, first of all, I don't want to shortchange the good things that we've done. I do think we've learned a lot in 6 months, and I think those numbers do matter. The one thing I would remind folks is that hospitals, the way we're built, you don't build a whole bunch of hospitals to have a whole bunch of empty rooms. It's almost like businesses where it's just on-time delivery. That critical care space is always limited, and right now it is very, very short. It does not take much of a spike to push over. The good news is we have that capacity out there. So, Tom, I hear that part of it. I may have Jan respond to this. The one thing I continue to keep saying is we as a state, in our economic activities, rank in the top third in terms of what's open, what's happening. States that have determined and said, and we see this through reservations and people going back to restaurants, there is no guarantee just because you don't put on some restrictions on gatherings that people are going to come back anyway. The biggest fear you have is when you get a spike like Texas that had massive economic impact when everything shut back down again. So I think it's a fair question. I think the statistics tell us that we're managing this the correct way. We continue, and I have to tell you, especially with restaurants and bars, that is a difficult business anytime before COVID-19. It's also a business that employs an awful lot of people and contributes greatly to our economy. But it's even more than that. It's the things that makes life so great to go out to a restaurant and see that. My heart is breaking that I know some of these folks, it's going to be a hard time to come back. But just because we have a 50% indoor capacity, if we went to 100%, there's pretty much evidence across the country that wouldn't have a huge impact. But I would argue, and maybe the epidemiologists and the health professionals would argue, we would actually see this curve grow if we make some of those moves. So,
You have turned the economic dial since I think June 10th. Is there any chance that these bars and restaurants that are many more in danger of going out of business permanently are going to see any kind of an increase anytime soon?
well, first of all, the virus will dictate where we go. And what I can say is we did not turn the dial backwards. And I just have to be candid with all of you. Every day we get on every morning to start the morning, and all of the commissioners from procurement to education to health to homeless and food security and all that give their brief. There's a very robust argument being made that we're at a point where we need to start thinking about some decisions. I made the decision with this administration that we would do a masking mandate to make an impact. Now, those who said, wow, when you made the masking mandate, we haven't seen much change. It didn't drop that much. If you go back in time and look at when we did it and compare us to neighboring states, what the masking mandate probably did, and I'm not going to make the claim as some do that it single-handedly made the difference, it had an impact on it to holding it down. And I think right at this point in time, Tom, my goal is to keep as much open as we have right now, to not have to turn the dial backwards, because to not do so when the time is right, and this is a tricky one, because if you wait until you fall off the cliff, it's too late. And if you pull it too soon, you put people out of work. So we'll continue to watch the numbers. We'll continue to try and make the right decisions. But I just do want to say to everybody involved in that business, we hear you on it, and we're doing everything we can to make sure we get people back safely in those businesses. Yes.
So are you saying that in those meetings in the cabinet or with the commissioners that there's maybe more of a push to turn the dial back at this point with where we're at?
There is always the discussion of putting it out, and I think it's a healthy discussion. One of the critiques I hear, and I speak to Republican legislators, Commissioner Malcolm, Chris Erzman, and the team, they have a responsibility to articulate the best public health data and the best courses of action. So does the economics, Steve Grove and others, to make the case of what's happening in the economy and where is the spot between them. Our job is to try and continue to balance public health, safety and security, and well-being. We had these conversations very early in this when we put up the PowerPoint, trying to strike that proper balance. So throughout this entire pandemic, it's expected in these meetings for people to articulate where they think things are going. And we've said it. I mean, people get like, oh, the modeling's not exact. No model is exact, but good models do predict trends. And their ideas that they're trying to articulate are always debated. So yes, there is a discussion that, and Dr. Birx brought it, just to be candid, the CDC's guidance is asking us to do that, is saying that they are suggesting that we go backwards on some of these openings. We believe that the behavioral changes, the mask mandate, and maybe another push on this can make the difference, that we can hold it. But that is a discussion that's happening.
Governor, given the concern about particularly off campus, are you considering any sort of rollback of campus bars in college towns, specifically targeting those communities?
Well, we are concerned with the college towns. We've seen it, whether it's Mankato, Winona, and of course here in Minneapolis and St. Paul and others. What I have believed from the beginning, and I think that's the case that we've been making, the partners in this are these establishments themselves. And just to be clear, the vast majority of them are doing everything according to the guidance, and we're not seeing those outbreaks. What we tend to see is a few spaces that lend the large number of cases. Is that fair to say, Chris, in what you're seeing? It's an isolated number of cases that disproportionately leads to those. So what I'm trying to, again, and I think this is what a lot of folks ask is, at this point in the pandemic, can you be strategic? And I have to be candid, that was one of the reasons with the enforcement mechanisms I put in. I wanted to use the enforcement as a strategic measure instead of across the spectrum. Now, there would be some that would argue, and this is what when we know social behavioral patterns, the number of bars visited on an individual night by one individual. And that starts to become a problem because you can be in a facility that is doing things right and then migrate to another one and then migrate back. And those are things that are a challenge. So I would just say we every day put every option on the table. They're looked through. We think about what the impact will be. We try and make the best informed decision, always with that health, safety, and well-being in place. But I would say, Jan, I hope I'm not speaking out of turn for you. You have had for quite some time a concern about the college towns and the return and what the impact might be.
We are on the dial with Senate Majority Leader.
Yes.
Yeah,
no, thank you. Just a little, about an hour ago or so, Senator Gazelka and I sat down to have a meeting, and just to be clear, it was really meant to kind of to clear the air. It's not that unusual 60 days out from an election that things get a little heated, but I think it's really incumbent, and I very much value the relationship with Senator Gazelka personally, and I think we showed last year we pulled off something that's pretty hard to do, divided legislature, and we got a tax bill, a budget bill, and we moved some significant legislation around, from opioids to to long-term care facility licensing and pharmaceutical work around diabetes, around insulin. And so that relationship is important personally, but that relationship is much more important to Minnesota because of the checks and balances between the legislative and the executive branch. And if those of you not following along, been a little heated here recently, I think both of us agree that's probably not the best way to go about business. We kind of had a set down to try and turn down the heat a little bit on that. And that doesn't mean that there's the expectation that we'll agree with each other. Senator Gazelka definitely sees our response to COVID differently. And that is a fair discussion to make, and I have to make the case and have to have the responsibility as governor that I'm making the best informed decision, but he has every right to make that. I think what we both talked about is that we need to keep it on a level where that relationship matters, where working together matters for Minnesotans, and I just think on personally, I don't take any joy out of when things get a little bit rough and tumble. I understand politics is that way, but I've always tried to focus on myself rather than that. And I just told him that I didn't feel really good that we're kind of getting into that space. So I would argue that it's in a good space.
Follow up on the executive order. Do you intend to continue your emergency powers when that decision comes up next week?
We're having the discussion now, and this was kind of a pre-discussion to that about what does next week look like. Obviously, there's a lot of things out there. There's a bonding bill. There's a supplemental budget. And again, we did not talk about it in detail, but we will. There is the discussion around the commissioners that a governor has the right and the authority to appoint, and the Senate has the right and the authority to either confirm or not confirm. And that will probably be another area of discussion. But I think what this meeting was to try and set the tone for the next one that will happen as we think about what next week looks like.
I have another question, Governor. Is there any different way you may have communicated the rules that were set out several months ago? A lot of people have been following the rules, but we're still seeing the spread of COVID-19. I mean, was this the right communication strategy, would you say?
That's a good point. I don't know, Jan, or I could maybe, this is one that I appreciate that question. I think I'm here today and we're kind of back in this mode we were because I'm asking that same question. I think for the most part, Minnesotans are very socially conscious about getting things done. I think this has been a summer of strain. I'm not telling anybody anything they don't know. We've seen civil unrest, unprecedented. We've seen a political climate that is fractured even more so. And that's the question I'm asking. Are we getting out of this? Are we doing enough of publicizing that? The problem I get right now is, and this is why we need third-party validators, I think as this became so politically charged, if I say today is Thursday, there's a significant portion of Minnesotans say, no, it's not, just because I said it. And I worry sometimes that when these political things get so charged that things that should not take this on. I just asked Jan and Chris before we came in here, with their experience and lifetime experience on this, do you think this would have looked the same 10, 20 years ago? Because I always worry about that trap. Oh, it's worse now than it's ever been. And people say, oh, no, we've had these political fights, we've done these things. And I think both of your assessments were that it's worse now. And so that, I think, requires, coming back to where you're at, do we need to look at different ways to communicate? And I think that maybe brings us back to this earlier question. This idea of making, I want the legislature to be a partner in this. I take no joy in anything that has to be done alone. I think the biggest thing is when they're a partner in it, it gets better buy-in, because I think many of you out there are, and last week you asked the question on this. Dr. Birx, the White House director on COVID, working with the vice president, came here and made it very clear that we're in trouble. Well, there have been several high-profile visits from the White House in the last several weeks that no mention of COVID was made and no attempt to talk about what we should be doing about it. And those mixed messages, I think, really confuse people. So we're trying to figure out how to break through, how to make the case. I'm here today to ask that. I think this is less about turning the dial and less about restrictions to put on and more about a social compact just to fix this. I mean, I just refuse to believe that other countries can get this a lot more right than we are, that they have something that we don't. And right now, it's simply the will for us to get over this. And at this point in time, you remember when some of you here, when we first came, the infection rates per 100,000, we were about the best in the nation early on. We really did that. And I'm telling you, during the shutdown, traffic dropped down to 2%. People stayed home. We had this thing pretty crushed. It's my contention is had we done that as a national strategy, we'd have got out of this thing by about May. We did not, and now it's incumbent upon us to talk about what is Minnesota going to do? How do we get together on this? Yeah. Yeah, sorry, I'll go quickly.
This might be for the Department of Health people. The wedding is, I think it might have been Hancock. Was that an outdoor wedding or an indoor wedding? And I'd also like you to take the opportunity to tell us, say it was an outdoor wedding. Should masks have been worn outdoors? Should masks be worn in an outdoor bar setting or a restaurant setting when people aren't? I think there's this perception that as long as you're outside, everything's cool. Is that true?
Thank you. Let me clarify that the wedding event was indoors, actually, and so that was the concern with capacity. But you raised an excellent question, and just to be clear, we did not give the location of the wedding, and it was in southwestern Minnesota. But just to clarify that, we did not give the location. The other thing, though, that has been a real confusion for people is outdoor versus indoor, and we've tried to reinforce that while all things being equal, that being outdoors is better than being indoors because you have better airflow, you have more space to distance, and oftentimes you'll have sunlight, which is positive. That doesn't mean that all of those three pillars of mitigation go away. You still need to be socially distanced. You still need to be masking if you're not within your sort of bubble of relationships. And you need to be making sure that you're continuing to do good hand washing and avoiding large crowds. So I think some people have gotten the mistaken notion that being outside eliminates risk. It reduces risk as compared to being indoors, but it does not eliminate risk. And so I think that's a real concern is, oh, we were outside. Well, if you're all clumped together, not masking and mixing with other, people that you don't normally aren't in your household or normally interact with, then you lose any benefit of being outdoors. So it's really important to keep in mind that all things being equal, socially distanced, masked, not in a large, huge group setting, then outdoors is much better. But if you're not maintaining those pillars, then you lose the benefits of being outdoors. And I think I answered all the elements of your question.
I noticed your messaging earlier about Trump advisor, Governor Burke's being here in the city. I'm wondering, because you mentioned the political pushback against pretty much everything you do. Is political pushback responsible for some of these outbreaks in parts of the state, or am I not putting those?
Yeah, no, and again, this is my opinion on this, that yes, I think it has now become a statement to not do certain things or not believe it. And you're right, I did focus on that because what I'm trying to cross over on this isn't me saying it, it's not my appointees saying it, this is the White House advisor saying that we should do these things. And what I'm trying to make the case of is, if it's easier to you to follow these things because President Trump's advisor told you to do it, then that goes to part of this messaging. I'm trying to make that message. If we were united in this, and I don't think I'm being naive on this, if the mask issue hadn't become an us versus them type of thing, I think the vast majority of people would just do it. It's not fun, it's not all that pleasant, but they would do it because it didn't have to say it. But now I do worry about, there's still, again, everybody can have their opinion, but this is not the flu. Everybody can have their opinion and say no one's at risk. Those things don't pan out with what the science facts say and what the medical community is. So you're right, I am saying it that way because I want you to know there's a vast array of people, including the president's advisors, who believe that wearing a mask, social distancing, and limiting indoor gatherings is the way that we get out of this thing and turn this around.
How do you think your job is more difficult when there are states around us in South Dakota, the fastest growing per capita rate in the country now, when people can drive a couple hours and less restriction? And another question is, are you talking to the governors in surrounding state provinces?
Yeah, this is the hardest one, and governors talk a lot. I mean, this is at no point in time where governors probably push to the forefront as much. And I've not spent a lot of time. One, it's counterproductive, and I think you do the work that's in front of you. But I think it's no secret to anybody that we have been fighting this like 50 individual countries, and it does make it difficult. And we try to be good neighbors. We try to make sure we're communicating. And yes, we do talk often. I talk an awful lot with Tony Evers, with Gretchen Whitmer, with Doug Burgum in North Dakota, and they get their best ideas, and they're getting good ideas. And I think there's an idea that this regionalism would be helpful. We tried early on to form that compact in the Upper Great Lakes. It didn't work as well as we thought. It still is kind of held together of sharing ideas amongst one another, but it does make it more difficult. And it makes it more difficult because people in this pandemic, and this is where I hope the epidemiologists go crazy, people will take two states and talk about infection rates and things like that and say, well, see, it's working there. Well, you can't compare a state with 600,000 population spread over 90,000 square miles with a density of 3.5 million people in a 7-county area here. This thing operates differently. And so it then becomes almost a competition. Some of it's healthy and friendly, but some of it is really counterproductive. And I want to just be clear. With Sturgis being such a high-profile thing, we had folks from Sturgis come back to Minnesota and get sick. But I'm certain there's Minnesotans that have gone to other states and got people there sick too. So it's not as if me saying self-righteously, you know, we're doing this and you're not. We're just trying to figure out to follow the science. I once again think in a pandemic, one national strategy would be a better way to do that. In the 39 countries that we've looked at around the globe, the ones that have been most successful have had a very clear strategy. Certainly the United States, a little more difficult, massive land size, different cultural attitudes. But this virus acts a certain way. If we respond to it in a certain way and get outcomes, those are predictable whether they're in South Korea, Brazil, or the United States. And we simply have not done that. And so your question is well taken. It's good. I'm not going to get into this battle with other states. And I think the one thing that has been really helpful, and Vice President Pence has helped lead on this, that we've had a weekly call with them, with all the governors on. That's pretty helpful. The really good one is the National Governors Association, where 50 governors are on. And boy, right there, political affiliation disappears, and you start talking about, you know, case positivity rate, community spread rate, hospitalization rates. Those are the types of state fairs. You all start talking about the commonalities that you have. So, Minnesotans, you're going to get ready. I want you to enjoy Labor Day. This is COVID-19 is taking an awful lot out of us. It's taking a lot of joy out of life, and I fully recognize that. We need to find it where we can. We need to find those moments of spending with family. We need to recognize our neighbors, many of them still unemployed, challenging situation. We've got folks with underlying health conditions that we're trying to protect. There will be a day we get through this. I want to thank Senator Gazelka again for the meeting today. I think the real effort to try and tone down political divisions in a time of a pandemic is really helpful. Differences are good, they're healthy. Dividing us as a state and as a nation is not good. And so we want to continue to work on that. Thanks to the health experts on this. Everybody stay safe this Labor Day, and we'll get this thing whipped. Thank you. Thanks, everybody. You know, that question about outdoors is really good. That's what Dr. Burke's focused on. And the aerosol nature, yeah.